Diabetes is a chronic condition that affects the body's ability to regulate blood sugar levels. While the symptoms can vary from person to person, here are 10 common symptoms that may indicate the presence of diabetes. 1. Frequent urination. Polyuria, increased thirst and the need to urinate more frequently than usual is a common symptom of diabetes. High blood sugar levels can cause the kidneys to work harder to filter and absorb excess sugar, leading to increased urination. 2. Excessive thirst. Polydipsia. As a result of frequent urination, the body may become dehydrated, leading to persistent feelings of thirst. This symptom is closely linked to the increased fluid loss associated with diabetes. 3. Unexplained weight loss. Sudden or unexplained weight loss can be a sign of diabetes, especially in type 1 diabetes. When the body is unable to utilize glucose properly, it starts breaking down fat and muscle for energy, leading to weight loss. 4. Increased hunger. Polyphagia. Despite eating more than usual, people with diabetes may experience constant hunger. This occurs because the body's cells are unable to absorb and utilize glucose effectively, leading to feelings of hunger and a lack of energy. 5. Fatigue and weakness. Diabetes can cause fatigue and weakness due to the body's inability to use glucose effectively for energy production. Insufficient energy production can leave you feeling tired, even after getting enough rest. 6. Slow wound healing. High blood sugar levels can impair the body's ability to heal wounds effectively. Sores, cuts, or bruises may take longer to heal than usual in people with diabetes. 7. Blurred vision. Fluctuating blood sugar levels can affect the lens inside the eye, leading to blurry vision. This symptom is usually temporary and improves when blood sugar levels are controlled. 8. Tingling or numbness. Prolonged high blood sugar levels can cause nerve damage, leading to tingling, numbness, or a pins and needles sensation, especially in the hands, feet, or legs. This condition is known as diabetic neuropathy. 9. Recurrent infections. High blood sugar levels can weaken the immune system, making individuals with diabetes more susceptible to infections. Common infections may include urinary tract infections, skin infections, and frequent yeast infections. 10. Increased thirst and hunger, accompanied by weight gain. In some cases of type 2 diabetes, individuals may experience increased thirst, hunger, and weight gain. This occurs because the body's cells become resistant to insulin, leading to elevated blood sugar levels and subsequent weight gain. It's important to note that these symptoms may also be associated with other medical conditions. If you experience any of these symptoms, it is advisable to consult a healthcare professional for an accurate diagnosis and appropriate treatment. There are primarily 3 types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Each type has distinct causes and characteristics. 1. Type 1 diabetes. This type of diabetes is an autoimmune disease in which the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, the body is unable to produce insulin, the hormone responsible for regulating blood sugar levels. Type 1 diabetes is typically diagnosed in children and young adults, although it can develop at any age. People with type 1 diabetes require lifelong insulin therapy to survive. 2. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for approximately 90 to 95% of all cases. It occurs when the body becomes resistant to the effects of insulin or fails to produce enough insulin to maintain normal blood sugar levels. Type 2 diabetes is strongly associated with lifestyle factors such as obesity, physical inactivity, and poor dietary choices. It usually develops in adulthood, but it is increasingly being diagnosed in children and adolescents due to rising rates of obesity. 3. Gestational diabetes. Gestational diabetes occurs during pregnancy and affects pregnant women who have never had diabetes before. It is characterized by high blood sugar levels that develop due to hormonal changes during pregnancy. In most cases, gestational diabetes resolves after delivery. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. It is important to manage gestational diabetes to avoid complications for both the mother and the baby. In addition to these main types, there are other forms of diabetes, including prediabetes. This condition occurs when blood sugar levels are higher than normal but not high enough to be diagnosed as type 2 diabetes. People with prediabetes have an increased risk of developing type 2 diabetes if they do not make lifestyle changes.